Today we are going to the pharmacist or chemist. We want to ask them some random questions like these drugs they are taking. Are they the one producing it or they are actually buying it? And those pharmacologists, are they a random kind of people that just prescribe drugs or they are actually a professional doctors? All these questions is what we want to ask them. Are they reliable? Do they save lives or they just prescribe drugs for people? And please, before we start, don't forget to subscribe and share. See you. Are you a professional doctor or you are a pharmacologist?
I own a patent medicine shop. Let me put it that way. I'm not a pharmacist.
Okay, sir. Sir, if you want to prescribe drugs for a patient, do you run a test for that patient or you just prescribe drugs for that person?
No, that's now all part of the all part of the trade or the business. We have a limit between the pharmacist and the patent medicine shop.
Okay.
The pharmacists, they are the professionals. Let me put it that way.
Okay.
We are also professionals in our own way, but look at it. We have our limitations. We have the drugs we are supposed to sell and the ones we are supposed to sell. And when you want to talk about prescription, being done by the doctors and the pharmacists, when they bring their prescription notes to us, that's when we sell the drugs.
Okay. Okay. So, sir, like if someone is in a critical condition, if a patient is in a critical condition, do you advise the patient to come for you to give him drugs, or you advise the patient to go to the hospital directly?
The most important thing, it depends on the closeness. If they come here first and we see the situation on ground, we can refer to the hospital or any other facility apart from the patent system.
Okay, sir. So there's I've noticed something like mothers that have infant children. If the child is having fever, they will want to take the child to a chemist instead of taking the child to the hospital. At this process, if anything happens to that child, who is to be taken responsible and who is to be held responsible?
The most important thing, when they bring the child, if that child is above a school, you have to refer. That's the most important thing. You refer to those people. You don't just take the chances.
Okay, sir.
It depends on the seriousness of that illness, ailment on that child or infant.
Sir, is this chemist, is it registered by NAFDAC?
We are under the Ministry of Health, but now we are under the Pharmacist Council of Nigeria. They are our boss. Let me put it that way.
Okay, sir. The drugs that we are taking, is it produced by you people or you actually buy the drugs?
No. We don't produce drugs. We buy from the manufacturers.
Are you a professional doctor or you are a pharmacologist?
None of them both.
All right. So, if your patient is in a critical condition, do you advise them to go to the hospital or you just prescribe drugs for them?
Actually, for a first start, if your condition is critical, you cannot run to the chemist or anywhere. First thing you need to do is take your patient to hospital for proper observation.
Okay, sir. Sir, do you run tests on your patients before prescribing drugs to them?
No, we do not. Sometimes we observe some cases before we give drugs. So in some cases, we can ask you to go and do tests to know actually what is wrong with you. But that the ones we can handle it on our own. That means we can prescribe drugs without tests.
Okay, sir. Is this place approved by NAFDAC?
Yes.
Alright. So I see some cases where some mothers, they will take their infant child, like they rush their infant child, maybe he or she is having fever, they rush them to the chemist just to get drugs. And I know and I think it's not appropriate. So if anything actually happened to that child in that extent, who are they going to hold responsible?
The chemist man.
Okay, because
he has no right to prescribe drugs for that child, for that kind of child.
Those drugs we are taking, are they actually produced by you guys or there's a company that produces the drugs?
There's a company. Our own is just to order it or we go for market to buy them. That's why it's our own. We're not the one producing drugs.
Ma, are you a professional doctor or you are a pharmacologist?
Somehow, I train in a pharmacy,
Alright.
so I think I know more about drugs.
Okay, ma. So, ma, before you prescribe drugs to people, do you test them, like where do test, or you just prescribe the drugs to them?
Depends on when the person comes. Maybe like some people they bring test results, then you check before you prescribe. When some people come with that is a complaint, then you ask them some few questions. When you see the symptoms of what they are complaining, you know what to give them.
Ma, in any critical condition, like maybe a patient is in a critical condition, do you advise the patient to go to the hospital directly, or you just prescribe drugs to them?
Depends the critical condition the customer is. Maybe like the customer have injury. Maybe like here, and I don't know about other pharmacies, they do dressing. But here we don't do dressing, we have to refer the person to the hospital. But if it's something that we can do here, we can give some drugs so that it can suppress the symptoms that the person is having, as in before referring it to the hospital.
Alright, ma. Ma, I noticed something like most mothers having an infant child, they will just maybe the child is having fever, they will take the child to the pharmacist instead of taking the child to the hospital. In that occasion, if anything actually happened to that child, who will be held responsible?
I think the pharmacy need to be whole responsible because an infant child need to be take care in antenatal that is a ward. When let me say mother bring an infant child, you don't know what they have been prescribing for the child, you don't know what they have been giving the child. So you need to refer the mother and the child to the hospital so they can continue their drugs over there.
Is this place approved by NAFDAC?
Yes.
These drugs we are taking, is it produced, like do you guys produce it or you buy it elsewhere? What is the name of the company we get these drugs?
The name of the company we get it.
Yeah.
Okay, let me see. We get some from like Enzo products now. We get it direct from Enzo company. While some other drugs we get it from Lagos, we get it from Onitsha.
Thank you so much for watching. I guess you all know when to visit the pharmacist and actually when to visit the hospital. So right now we actually know the name of companies that produces our drugs and where our drugs is coming from. And please don't forget to subscribe and share. And if you have any comments, just drop it on our comment section. See you in our next video. Bye.